Phlebotomy Mock Exam 2026. Question 1. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A. Hold the needle steady inside the vein to complete the draw. Option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C. Place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D. Restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 2. What type of fluid is obtained during a lumbar puncture procedure? Option A. Pleural fluid. Option B. Synovial fluid. Option C. Cerebrospinal fluid, CSF. Option D. Peritoneal fluid. The correct answer is option C. Cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 3. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A. 70 to 99 mg/dl. Option B. 140 to 180 mg/dl. Option C. 200 to 250 mg/dl. Option D. 300 to 350 mg/dl. The correct answer is option A. 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 4. What is the primary purpose of the Joint Commission's National Patient Safety Goals, NPSG, in phlebotomy? Option A. To reduce the cost of laboratory testing instruments. Option B. To improve the accuracy of patient identification and eliminate diagnostic errors. Option C. To mandate the exact number of draws a phlebotomist must perform per hour. Option D. To regulate the salaries of medical laboratory technicians. The correct answer is option B. To improve the accuracy of patient identification and eliminate diagnostic errors. The National Patient Safety Goals emphasize accurate patient identification to reduce diagnostic and treatment errors. In phlebotomy, this directly affects bedside identification, specimen labeling, and matching the order to the patient. The goals are not designed to set draw quotas or regulate laboratory salaries. Question 5. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A. Light blue top, sodium citrate. Option B. Green top, heparin. Option C. Lavender top, EDTA. Option D. Gray top, potassium oxalate. The correct answer is option B. Green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 6. What is the function of platelets, thrombocytes, in the human body? Option A. Transporting carbon dioxide back to the pulmonary system. Option B. Producing specific antibody proteins to neutralize viral particles. Option C. Participating in primary hemostasis by aggregating to form a platelet plug. Option D. Maintaining systemic core body temperature variations. The correct answer is option C. Participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 7. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A, 70% isopropyl alcohol. Option B, tincture of iodine. Option C, chlorhexidine gluconate or soap and water. Option D, hydrogen peroxide. The correct answer is option C, chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 8. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A, releasing the tourniquet within 1 minute of needle insertion. Option B, keeping the patient's arm down during the venipuncture procedure. Option C, allowing the patient to pump their fist repeatedly before and during the draw. Option D, transporting the specimen to the laboratory within 30 minutes. The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 9. What is the target population for a Guthrie card or newborn screening test panel? Option A, geriatric outpatients in nursing homes. Option B, infants up to a few days or weeks old. Option C, pregnant women in their first trimester. Option D, patients undergoing active chemotherapy treatments. The correct answer is option B, infants up to a few days or weeks old. Guthrie cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 10. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A, advance the needle deeper to see if the pain stops. Option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C, tell the patient that minor discomfort is completely normal for this vein. Option D, instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 11. What is the correct site for performing a dermal puncture on an adult patient's finger? Option A, the exact center of the finger pad on the index finger. Option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Option C, the side of the pinky finger close to the nail bed. Option D, the palmar crease of the thumb. The correct answer is option B, the fleshy, off-center side of the distal segment of the middle or ring finger. Adult finger puncture is performed on the fleshy, off-center side of the distal segment of the middle or ring finger. This location provides good capillary flow while avoiding bone and heavy nerve concentration. The center pad, thumb, index finger, pinky, and nail areas are less desirable. Question 12. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option A, recapping the needle before throwing it away. Option B, placing the needle in a biohazard bag. Option C, activating the safety device and placing it in a sharps container. Option D, dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C, activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 13. What is the correct action if a phlebotomist cannot find a suitable vein in either of the patient's antecubital fossae? Option A. Probe blindly in the area where the median cubital vein should be located. Option B. Inspect the dorsal aspects of the patient's hands for accessible veins. Option C. Attempt a venipuncture on the inside aspect of the patient's wrist. Option D. Draw blood from a vein located on the anterior aspect of the lower leg. The correct answer is option B. Inspect the dorsal aspects of the patient's hands for accessible veins. If antecubital veins are not suitable, the dorsal hand veins are the usual next site to inspect. They require careful anchoring and often a smaller device because they are more fragile. Blind probing or using wrist and lower extremity sites increases risk and may require special approval. Question 14. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option A. Light blue top. Option B. Lavender top, EDTA. Option C. Gray top. Option D. Green top. The correct answer is option B. Lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 15. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A. Sodium heparin and a gel barrier. Option B. Lithium heparin and a gel barrier. Option C. DDTA and a gel barrier. Option D. Clot activator and a gel barrier. The correct answer is option B. Lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 16. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 17. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A. Lightmia. Option B. Icterus. Option C. Hemolysis. Option D. Hemoconcentration. The correct answer is option C. Hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lightmia appears milky, and icterus appears yellow to amber. Question 18. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A. 5 to 10 degrees. Option B. 10 to 15 degrees. Option C. 30 to 45 degrees. Option D. 60 to 90 degrees. The correct answer is option B. 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 19. Which of the following elements is a primary link in the chain of infection? Option A. The source or reservoir of the pathogen. Option B. The cost of personal protective equipment. Option C. The layout of the outpatient laboratory facility. Option D. The brand of antiseptic wipes used to clean benches. The correct answer is option A. The source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 20. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A, powdered latex. Option B, non-powdered latex. Option C, nitrile or vinyl. Option D, cotton utility gloves. The correct answer is option C, nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 21. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 22. Which of the following errors is an example of a post-analytical error? Option A, failing to mix an EDTA tube, causing a microclot to form. Option B, mislabeling a patient's name at the bedside drawer. Option C, delayed reporting of critical panic values to the attending physician. Option D, leaving a tourniquet on a patient's arm for 3 minutes. The correct answer is option C, delayed reporting of critical panic values to the attending physician. Delayed reporting of a critical value occurs after analysis, so it is a post-analytical error. Timely communication of panic values is essential because treatment may depend on rapid notification. Collection, labeling, and tube mixing errors occur before analysis. Question 23. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 24. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A, lavender, green, red. Option B, red, green, lavender. Option C, green, lavender, red. Option D, light blue, lavender, green. The correct answer is option A, lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 25. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 26. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A. Voiding directly into the cup without any prior cleaning steps. Option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C. Saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D. Restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 27. Specimen tubes must be labeled at what point during the collection process? Option A. Prior to entering the patient's room. Option B. Immediately after drawing the blood, before leaving the patient's side. Option C. At the central processing lab desk. Option D. After the specimen has finished centrifuging. The correct answer is option B. Immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 28. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A. Rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 29. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A. Use the partial sample anyway and send it to the lab. Option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C. Pour blood from a green top tube into the light blue tube to top it off. Option D. Shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 30. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A. Syncope. Option B. Shock. Option C. Vertigo. Option D. Hemostasis. The correct answer is option A. Syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 31. What is the primary function of the anticoagulant EDTA? Option A. It enhances the action of thrombin. Option B. It binds calcium ions, preventing the clotting cascade from activating. Option C. It destroys white blood cells to preserve red cells. Option D. It stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B. It binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 32. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 33. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A, falsely high fats in the patient's diet. Option B, high concentrations of bilirubin in the serum or plasma sample. Option C, excessive destruction of red cells inside the tube due to rough handling. Option D, utilizing the wrong color top tube during collection. The correct answer is option B, high concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 34. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A, lactic acid and ammonia. Option B, cold agglutinins and cryoglobulins. Option C, bilirubin and vitamin B6. Option D, prothrombin. Patient. The correct answer is option A, lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 35. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A, wearing a laboratory coat. Option B, utilizing self-sheathing safety needles. Option C, hand washing after every procedure. Option D, disposing of waste in a biohazard trash bag. The correct answer is option B, utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 36. For which of the following tests must the specimen be protected from light immediately after collection? Option A, ammonia. Option B, bilirubin. Option C, lactic acid. Option D, prothrombin. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 37. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 38. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 39. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 40. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A. Collecting blood from a patient with a suspected MRSA skin infection. Option B. Drawing samples from a patient diagnosed with measles or active varicella. Option C. Performing venipuncture on a patient with seasonal rhinovirus. Option D. Collecting a lipid panel from a patient with hepatitis C. The correct answer is option B. Drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 41. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A. Complete blood count, CBC. Option B. Blood cultures. Option C. Erythrocyte sedimentation rate, ESR. Option D. C-reactive protein, CRP. The correct answer is option B. Blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 42. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A. Use the tube anyway if it is the only one available on the tray. Option B. Discard the expired tube and select a current, unexpired tube from inventory. Option C. Assume the additive inside is still functional for another 6 months. Option D. Write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 43. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B. A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 44. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A. Syncope. Option B. Lymphedema and altered test results. Option C. Petechiae. Option D. Sclerosed veins. The correct answer is option B. Lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 45. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A, artery. Option B, capillary. Option C, vein. Option D, arteriole. The correct answer is option C, vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 46. A specimen for a lactic acid test must be handled using which special accommodation? Option A, placed immediately on an ice slurry. Option B, incubated at 37 degrees Celsius until tested. Option C, kept away from all light sources using foil. Option D, centrifuged immediately within 5 minutes of draw. The correct answer is option A, placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 47. Which of the following tubes contains a clot activator paired with a gel barrier separator? Option A, gold top, SST. Option B, light green top, PSD. Option C, lavender top. Option D, light blue top. The correct answer is option A, gold top, SST. Gold SST tubes contain a clot activator and gel separator. The clot activator promotes serum formation, and the gel forms a barrier during centrifugation. PSD tubes contain heparin for plasma, while lavender and light blue tubes contain anticoagulants for other testing. Question 48. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A, the functional capacity of platelets to adhere to vessel linings. Option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C, the total count of circulating red blood cells per microliter. Option D, the efficiency of the kidney to filter out waste urea molecules. The correct answer is option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 49. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas, ABG, draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 50. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 51. What color top tube is used to collect specimens for blood bank immunohematology testing like antibody screens? Option A, pink top or glass red top. Option B, gray top. Option C, light blue top. Option D, light green top. The correct answer is option A, pink top or glass red top. Pink EDTA tubes or glass red tubes are commonly used for blood bank immunohematology testing such as antibody screens. These specimens support red cell typing and compatibility testing. Gray, light blue, and light green tubes serve glucose, coagulation, and chemistry testing needs. Question 52. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A, the skin has developed calluses that block capillary action flow. Option B, the child's heel bone is too small to locate accurately. Option C, walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D, walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, heel tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Heel puncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 53. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT instruments. Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 54. What type of cleaning solution should be used to disinfect a phlebotomy tray on a daily basis? Option A, concentrated isopropyl alcohol. Option B, a 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Option C, warm water mixed with mineral oil. Option D, liquid hand soap solution. The correct answer is option B, a 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Phlebotomy trays should be disinfected with a bleach dilution or EPA-approved hospital disinfectant. Daily and visible soil cleaning reduces transfer of bloodborne pathogens and environmental organisms. Water, mineral oil, or hand soap alone does not provide adequate surface disinfection. Question 55. What is the proper location for a capillary puncture on an infant's foot? Option A, the center of the plantar surface near the arch. Option B, the medial or lateral borders of the plantar surface of the heel. Option C, the tip of the great toe. Option D, the posterior curvature of the heel bone. The correct answer is option B, the medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 56. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 57. Why is the first drop of blood wiped away during a capillary puncture? Option A, it contains skin surface bacteria. Option B, it contains tissue fluid contamination. Option C, It hemolyzes too rapidly to be accurate. Option D. It clots too quickly to be collected. The correct answer is option B. It contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 58. What should a phlebotomist do if they accidentally touch the site after it has been cleansed with alcohol? Option A. Proceed with the venipuncture immediately before the site gets contaminated further. Option B. Blow on the skin surface to dry any skin oils that transferred. Option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Option D. Wipe the needle tip with alcohol before inserting it into the skin. The correct answer is option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Touching a cleaned puncture site recontaminates the skin and compromises antisepsis. The site should be cleansed again with a fresh prep pad and allowed to air dry. Wiping the needle or blowing on the skin does not restore a clean field. Question 59. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A 9:1. Option B 4:1. Option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 60. What is the clinical term for a localized infection or inflammation of the bone caused by accidental needle striking during a heel stick? Option A osteosarcoma. Option B osteomyelitis. Option C osteoarthritis. Option D osteopenia. The correct answer is option B, osteomyelitis. Osteomyelitis is infection or inflammation of bone. In heel puncture, it can occur if the lancet penetrates too deeply and injures the calcaneus. Proper site choice and maximum depth limits are used to prevent this serious complication. Question 61. What is the correct order of draw for a capillary puncture when collecting multiple microcollection tubes? Option A serum tubes, heparin tubes, EDTA tubes. Option B EDTA tubes, other additive tubes, serum tubes. Option C heparin tubes, EDTA tubes, serum tubes. Option D serum tubes, EDTA tubes, heparin tubes. The correct answer is option B, EDTA tubes, other additive tubes, serum tubes. Capillary order of draw places EDTA specimens first, followed by other additive tubes and then serum tubes. This order helps prevent microclot formation in small volume hematology specimens. Venipuncture order cannot simply be applied to skin puncture collections. Question 62. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A drawing blood from a patient who has explicitly refused the procedure. Option B making a minor clerical error on a specimen tube label. Option C forgetting to wash hands between routine patient encounters. Option D accidentally causing a small hematoma during an authorized draw. The correct answer is option A, drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 63. Which of the following conditions can lead to a lipemic specimen? Option A. The patient did not fast before a lipid panel draw. Option B. The specimen was hemolyzed during collection. Option C. The tube was left under direct light for too long. Option D. The patient was severely dehydrated. The correct answer is option A. The patient did not fast before a lipid panel draw. Lipemia often occurs when blood is drawn after recent dietary fat intake. especially before lipid testing. The serum or plasma may look cloudy or milky from circulating lipoproteins. Hemolysis causes a red tint, while icterus produces a yellow to amber color. Question 64. Which of the following tests is used to monitor a patient's heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, hemoglobin A1C. Option D, rheumatoid factor, RF. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 65. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 66. What color top tube is used to collect specimens for lead testing? Option A, tan or royal blue with EDTA. Option B, light blue. Option C, light green. Option D, yellow. The correct answer is option A, tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 67. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 68. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option A, light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 69. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 70. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A. Transporting the specimen to the laboratory on ice. Option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C. Using a green top tube containing sodium heparin. Option D. Labeling the specimen tube at the patient's bedside. The correct answer is option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 71. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A. Resin or activated charcoal particles. Option B. Sodium polyant whole sulfonate, SPS. Option C. Acid citrate dextrose, ACD. Option D. Thixotropic gel barrier. The correct answer is option A. Resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 72. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A. Royal blue top tube. Option B. Lavender top tube. Option C. Light blue top tube. Option D. Grey top tube. The correct answer is option A. Royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 73. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A. Negative pressure isolation room, airborne precautions. Option B. Positive pressure isolation room, protective isolation. Option C. Standard contact isolation room. Option D. Droplet precaution room. The correct answer is option A. Negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 74. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A. The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 75. Which of the following structures is an example of an unoxygenated blood carrier? Option A. Pulmonary vein. Option B. aorta. Option C. Superior vena cava. Option D. Brachial artery. The correct answer is option C. Superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 76. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A. Light blue top. Option B. Lavender top. Option C. Grey top. Option D. Green top. The correct answer is option C. Grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 77. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A, sodium citrate. Option B, EDTA. Option C, heparin, lithium, ammonium, or sodium. Option D, potassium oxalate. The correct answer is option C, heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 78. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 79. What color tube top indicates that the tube contains the additive sodium heparin? Option A, light blue. Option B, dark green. Option C, lavender. Option D, light green. The correct answer is option B, dark green. Dark green tubes indicate sodium heparin in many tube systems. Sodium heparin prevents clotting by interfering with thrombin activity and is used for selected chemistry or special testing. Light green usually contains lithium heparin with gel, while lavender and light blue contain different anticoagulants. Question 80. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 81. What is the clinical purpose of performing a bleeding time test? Option A, to evaluate the integrity of the intrinsic coagulation pathway. Option B, to assess platelet function and the capillary bed's ability to form a primary plug. Option C, to measure the absolute concentration of fibrinogen molecules in plasma. Option D, to screen the body for active systemic bacterial infections. The correct answer is option B, to assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 82. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 83. Which of the following statements is true regarding standard precautions in healthcare settings? Option A. They apply only to patients with known, documented infectious diseases. Option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C. They require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D. They permit the recapping of used needles as long as you use two hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 84. What is the function of the systemic circulatory system? Option A. Moving blood exclusively between the heart and the lungs for gas exchange. Option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C. Filtering liquid waste products through the nephron beds of the kidneys. Option D. Producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 85. Which of the following tests requires that the sample be protected from light by wrapping the tube in aluminum foil? Option A. Vitamin B12 and carrot. Option B. Blood urea nitrogen, BUN. Option C. Partial thromboplastin, PTT. Option D. Complete blood count, CBC. The correct answer is option A. Vitamin B12 and carrot. Vitamin B12 and carrot are light sensitive and may require protection with foil or an amber container. Light exposure can degrade sensitive analytes and produce inaccurate results. BUN, PTT, and CBC do not have the same routine light protection requirement. Question 86. Hemoconcentration can be caused by which of the following actions? Option A. Leaving the tourniquet on for longer than 1 minute. Option B. Using a needle that is too small for the vein. Option C. Inverting the collection tubes too slowly. Option D. Puncturing the skin before the alcohol is dry. The correct answer is option A. Leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 87. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A. Hypovolemic shock. Option B. Septic shock. Option C. Anaphylactic shock. Option D. Cardiogenic shock. The correct answer is option A. Hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 88. How many times should a light blue top tube be inverted immediately after collection? Option A. 1 to 2 times. Option B. 3 to 4 times. Option C. 5 to 8 times. Option D. 10 to 12 times. The correct answer is option B. 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 89. Which of the following elements is a key component of quality control in a point-of-care testing? POCT, Program. Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 90. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, verbal consent. The correct answer is option C, implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 91. Which of the following is an example of an implied consent scenario? Option A patient signs a formal document for an invasive procedure. Option B, an unconscious emergency room patient requiring urgent diagnostic lab work. Option C, a patient verbally states they agree to the blood test. Option D, a parent signs a waiver for their underage child. The correct answer is option B, an unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 92. What type of specimen is used for a guaiac smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 93. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B, it can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 94. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 95. What is the correct clinical action for selecting a puncture site on an arm that has an active intravenous line? Option A, draw from a site distal to below the line to minimize fluid contamination. Option B, draw directly above the line insertion site. Option C. Adjust the fore flow rate to run faster during the draw. Option D. Draw from the fore line without flushing it first. The correct answer is option A. Draw from a site distal to, below, the fore line to minimize fluid contamination. The fluids can dilute or contaminate specimens collected near the infusion source. When collection from an forearm is unavoidable and allowed by policy, a site below the fore is selected with appropriate coordination. The opposite arm remains preferred because it avoids infusion-related interference. Question 96. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A. Collecting the sample while the patient is crying intensely or under extreme stress. Option B. Chilling the specimen on an ice slurry before transport. Option C. Protecting the collection tube from direct artificial room lights. Option D. Allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A. Collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis. Question 97. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A. Distal to, below, the hematoma in the right arm, or use the left arm. Option B. Directly through the center of the active hematoma swelling. Option C. Proximal to, above, the hematoma on the upper right arm. Option D. From the foot on the same side as the hematoma. The correct answer is option A. Distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 98. Which of the following is the most critical step in performing any phlebotomy procedure? Option A. Choosing the correct size needle. Option B. Verifying patient identification. Option C. Selecting the appropriate vein. Option D. Applying the tourniquet tightly. The correct answer is option B. Verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 99. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A. Sodium polyant whole sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Sodium citrate. Option D. Potassium oxalate. The correct answer is option B. Acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 100. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic metabolic panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures.